HRT, hormone replacement therapy, is a process by which the hormones that are lacking from the human body are replaced. And this is mainly estrogen and progesterone. It can be for reasons of aging, and where women go through the menopause, or it could be due to reasons like surgical removal of ovaries, but all of them aim to replace the main component, which is estrogen. HRT should be offered to any woman who is having low estrogen levels for varying reasons, either due to surgery where the ovaries have been removed or they have stopped functioning quite early in life, or as the function starts dwindling in the perimenopause phase and when it's completely stopped functioning after the age of menopause. HRT is mainly aimed at replacing the estrogen components of the hormones. We mainly use estrogen and progesterone. The progesterone does not require replacing. However, if estrogen is given without any counteraction of the progesterone, the lining of the womb does tend to increase in size and can potentially lead to a risk of cancer of the lining of the womb. Therefore, women who do not have a womb do not require the progesterone component and can only require the estrogen. HRT is administered in various ways. It could be as a tablet. Sometimes it's put through the skin either as a patch, a gel, and even can come in as a spray. For patients who prefer it, it can also be done as a vaginal pessary that is inserted at the regulated times. HRT has numerous benefits, and a lot of women, when the estrogen levels start dropping in the perimenopause phase or in the menopause, have realized that their functioning has reduced, either with the impact on their bones, the impact in their energy levels, and more so even brain functions where you have brain fog. The symptoms of menopause are very wide and varying. Some include lack of sexual drive, vaginal dryness with pain, skin changes, and also hair changes. The list goes on, hence the need for an option of HRT. HRT, just like any other medication, does have risks. And for a long time now, the risks have been overinflated, and therefore people have been a bit worried about using the HRT. And thankfully, this is changing now, and we're getting a bit more perspective as to what the risks are. The biggest risk, obviously, is the impact of HRT on your risk for breast cancer. And again, this is something that you would need to talk to your doctor, and something I would be able to talk to my patients to help quantify that risk. It varies in different people and different ages, and also the duration in which you take the HRT. Oh, if you ask me, everyone should stay on HRT for life, but again, it is where you get the risk and benefits valid. What you want to look at is how much risk can I consider having, and what's the benefit of the HRT? As age goes on, the risks start changing, and you start having risks of bone thinning where you really do need the estrogen. And other people do find that the risk of breast cancer increases due to family risk or individual risks, and this has to be balanced. So there is no limitation to how long you should stay on HRT, and it's something that needs to keep being reassessed with time. That is a difficult question. HRT does change the hormone constitution, and initially when you start your HRT, especially if your estrogen levels were low, that sudden increase can lead to water retention and with a perception of weight gain. However, ideally, HRT taken with continued healthy lifestyle should not make you gain weight. Breast cancer is classified into various types of cancer. A lot of them are cancers which are receptive to estrogen, or progesterone, the two hormones that we use with HRT. And indeed, taking any additional estrogen can lead to recurrence or an increased risk of the breast cancer coming back. Therefore, in my practice, we do tend to work quite closely with the breast surgeons and the oncology team to understand the risks associated with the breast cancer before advising about HRT. If it is not possible to give HRT, there are a lot of adjuvant treatments which are non-hormonal that we will be able to offer and discuss to help reduce the symptoms of menopause. Before starting HRT, the most important aspect is looking at the risks associated with the taking of the HRT, understanding whether you actually do need to take HRT or whether the symptoms that you're targeting are due to some other reason. This is by thorough health check and a history taking by your doctor. The next bit is to discuss the ways in which we can give you the HRT, the modalities in which you can approach it, either by tablets or patches or indeed implants. And all of these are personal choice and preferences that need to be considered. Once we've been able to establish if you do need HRT, whether HRT will help you and which route works best for you, then we can decide on the dosage, and that will be something we will monitor and increase or reduce as needed. There are alternatives to HRT, and this depend on the symptoms that we're targeting. Quite recently, we've had non-hormonal treatment for hot flashes that has been licensed, and that's called fezolinetant, or more commonly known as Veozah. This has been quite a good alternative for people who do not want to have hormonal replacement. There are other herbal treatments, though this cannot be quantified and hence not prescribed as such. Depending on the symptoms, again, you could have antidepressants, which are used very much for symptoms like hot flashes as well. Therefore, it is worth having a conversation with your doctor as to what symptoms you do want to have treated and whether they can be managed without the replacement therapy with hormones. At the initial phase, it is important to have regular follow-ups when you start your dosage, and also at the very least every year it is worth reviewing your risk profile to ensure that the risks do not start outweighing the benefit of using a HRT. The perimenopause phase can be quite daunting and also one that is tricky for us practitioners in trying to get the right dosage, because the hormone levels do tend to go up and come down without any predictable pattern. Therefore, when we're using HRT during this phase, a more regular review by your doctor, maybe every 6 months, might be worthwhile so that you can have the dosage in a more regulated way and to keep the levels quite regular. Once you're through the menopause, HRT can still be beneficial. The unfortunate bit is that a lot of the regulations and guidelines that we have are based on people who are either just going through the menopause or early in their menopause phase. However, we are getting a lot more literature and knowledge about starting HRT later on in life, and again, it is something that is worth discussing so that you understand the risks and the benefits of it. But there is certainly benefits in having estrogen replacement even at an older age. Shortage of HRT has become something that has become very common in our lives now. And whenever you do have a shortage, it could be of the particular type of HRT that you are using, and therefore it is worth trying to have a different modality or even a different trade name which gives you the same amount of estrogen. And if that is not available, again, your doctor will be able to source and tell you which one is available and change it to the appropriate dosage.